More and more Americans are developing diabetes at younger and younger ages, prompting the medical profession to develop innovative ways to treat this disease. Dr. John Gilbert of St. Jude Medical Center in Fullerton explains the latest steps in diabetes management.
Diabetes is a very common condition and has something to do with our inability to absorb nutrients like protein, carbohydrates, and fats. Over the last decade, the number of adults with type 2 diabetes have increased about 30%. And more serious condition is that adolescents, those between 20 and 39 years of age, the incidence of diabetes has increased 79%. It's growing at a rapid rate, actually for very simple reasons. It's growing because we're becoming heavier and less active over the last decade. Now, why is this so serious? Because now you're having patients develop diabetes when they're 20, 30 years of age, rather than in the past where they developed diabetes when they're 50 years of age. And usually the complications of diabetes occur 20 years after the diagnosis. So imagine a world and society where people get diabetes at 30 and develop the heart attacks and stroke at 50. And that's going to have a huge impact on the family, society, and our economic system here. Since the mid-1990s, there has been a number of very pivotal studies. One was in type 1 diabetes called the DCCT in 1995. One was the UK PDS study, which is the United Kingdom study, in 1998. These results were revealed, and it showed without any question that the degree of blood sugar control directly correlates with the development of diabetes complications. Before this time, it was clear that there was a relationship, but it's not until a really important study does it allow society and the medical community to really act on those studies. So since then, since the mid-1990s, physicians and patients, other healthcare providers have been very aggressively trying to improve diabetes control. Around the same time, over the last 7 years, there have been 4 new oral drugs to manage diabetes. And over the same time period, there have been 2 brand new types of insulin therapy. What this allows us to do, the more tools you have, there's a greater chance to reach your goals of better control. The other thing that's changed over the last decade in management, we don't only think of diabetes as sugar control. We're now realizing this is a cardiovascular disease, which means that a pre-diabetic, someone before diabetes, and a diabetic, really the greatest risk they have in terms of their health is a stroke and heart attack. So the other thing that's changed is now when we choose medications to treat diabetes, not only do we use medications to lower blood sugars, we choose medications to prevent cardiovascular disease. So a lot of our diabetic pills, in fact, are cardiovascular drugs that correct the cholesterol problem, that prevent heart disease. And some of the new medications we're working with help with weight loss. In addition to new promising medications, there's also a new kind of paradigm switch in that we're thinking about diabetes as a preventable disease. And there are many studies going on now with patients that have marker signs of what's called metabolic syndrome or pre-diabetes. These are patients that have slightly abnormal blood sugars, but not in the range to be considered diabetics. And there are 5 or 6 studies that I'm aware of that are using lifestyle changes, that are using very safe medications that are already being currently used for diabetes to try to prevent the development of diabetes. And any disease, if you try to prevent the development, is much more efficient than trying to treat a disease after it's already developed.